We're going to talk a little bit about practicing an integral approach to mental health this afternoon, and we'll follow up with one of the most exciting therapies that is integral in nature, and that's acupuncture. I graduated from Emory University School of Medicine in 1989, very conventional, very traditional system of care. I did an internship in medicine and pediatrics and really loved the primary care approach to health and sickness. I spent a brief 10-year period or so getting sucked into anesthesia. I've completed my residency in anesthesia in 1993 and then did a fellowship year in pediatric anesthesia at Scottish Rite Children's Hospital. Now, it was there I became very interested in chronic pain and the treatment of chronic pain. And I was about as well trained as one could be in both interventional pain management and medication pain management. And I got the biggest sense that what we were doing was very inadequate for the patients. Chronic pain is a chronic illness, and it just didn't respond that well to the therapies we had to offer. But I thought, well, you know, okay, this is the best we can offer, and so let me engage with this. And I really loved, unlike anesthesia, I loved getting to know the patients and interfacing with them over a period of time. So in 1999, I discovered the beauty of acupuncture. And I began to study Eastern medicine, Eastern philosophy, and something called an integral approach to psychology, medicine, life, in fact. And so it's within that context over the past 14 years that I've forged a practice independent of the third-party payer system, independent of the federal and state government, and I hope the ability to treat whoever walks through our doors. We have a sliding scale for people that can't afford it. Using things like group acupuncture and community acupuncture, it makes it very affordable, for example, in the addiction setting. Mental illness is defined as all diagnosable mental disorders or health conditions that are characterized by alterations in thinking, mood, or behavior. Let's look at some statistics. We're in the middle of an epidemic of, quote, mental illness. Why is this? So we'll talk about some questions that raises for me in just a second, but let's just look at the statistics. There's been almost a threefold increase in the 20-year period from 87 to 2007 in American adults who qualify for disability under mental health diagnosis. In children, the increase is a shocking 35-fold. Mental illness is now the leading cause of disability in children and the second leading cause in adults. One in two adults meet the American Psychiatric Association's criteria for mental illness at some point in their lives, and this includes anxiety, phobias, PTSD, depression, and other mood disorders such as bipolar, impulse control disorders such as ADD and OCD, and also substance abuse disorders. And I'm thinking, you know, if we add in the behavioral addiction, I heard a shocking statistic recently where someone said if we add in all the behavioral addictions that we Westerners can have, I've treated anything from shopping addicts to shoplifting addicts to addicts, you know, that are addicted to drugs and alcohol. But if we add in workaholism and pornography, you know, the numbers go way, way up. I would say, you know, around 50% would meet the American Psychiatric Association. The best definition I've heard for addiction is a continued engagement in a behavior despite negative consequences. So, you know, alcoholism becomes not about how often you drink or how much you do, but why you drink in the first place and then what happens when you do. So I have patients whose wives have told them, if this keeps happening, I'm taking the kids and I'm leaving, and then, you know, somehow it keeps happening. So, so we treat that quite a bit in our clinic. So these are important questions that I like to think about when treating a patient. If these disorders that I just mentioned are biologically based, I mean, we come at them with medicines as though they're biologically based, then is this increase real? Are we really that sick, or are we just better at diagnosing? A third option is we're pathologizing what's the normal human condition and labeling it. The other question I have is if the drugs are really that effective, then wouldn't we see a decline in the number of patients showing up in our offices for ongoing therapy? So that's something to think about. I have patients that have been on antidepressants 20, 30, 40 years, and they identify a joyful life, contributing to the community, and a lot of them are just afraid to go off of it. So anyway, we talk about this in the clinic. Do the antidepressants work? And if so, what do we mean by that? Do antidepressants cause more harm than good over the long run? What's the proper role of antipsychotics and anxiolytics? This has come up lately with the third-party payer system and all the debate about what is our right to medical care and how we're going to reimburse it and so forth. But how much is the medical profession allied with the pharmaceutical industrial complex, as I heard someone call it recently? And what is the motivation of the pharmaceutical industry as a whole? There is an absolutely excellent article in the New York Review of Books, and I've passed out a bibliography, or if you don't have it, Carol has access to it. But there's a bibliography that I sent that has several sources that I've put together. But on that bibliography is a reference to the New York Review of Books, The Epidemic of Mental Illness, Why? And it's a review of 3 different books, 2 of which were written by psychiatrists and 1 by a layperson on using something. It was a review of these books on deciding exactly what's the matter when we just use medications to treat mental illness, and what results from that. So please look that up. You can get it free on the internet. Now, integrative medicine is the new buzzword. You know, I saw an integrative anti-aging clinic where they might give you a little growth hormone, and they might give you a little testosterone, and they might offer a little Botox therapy. And so integrative typically means that we're just doing a little bit of everything, you know. Integral medicine, and this speaks to something the previous speaker touched on, integral medicine means that development is the goal. So that we're not just peeing and pooping and showering and eating, but we're actually making a contribution and fulfilling our highest potential. Western medicine is based on a dominator hierarchy, yes, where the physician in the white coat will tell you, I'll tell you what to do. You know, and my parents learned to never question that. They just did what the doctor said. Well, now we're in a new era of medicine where we're more in partnership with our patients. And when you spend time, as we do in our clinic, week after week and month after month, I've got patients now I've been seeing on a regular basis for almost 15 years, you know, you really get to know them, and hopefully the practitioner has continued on her developmental journey, so I'm always one step ahead of the patient as far as development. Hopefully I'm engaging in therapy or some sort of developmental work outside of the office so that I can always put a developmental tug on the patient. How? By asking questions, by embodying virtue. I recently heard a woman at a fundraising event who had been, her name was Liz B. She had been sober 60 years in a 12-step program. She was 90 years old. Her entire adult life had been about radical change, growth, and development, and it showed just from the speech she gave. So, you know, as a 50-year-old woman, if I asked her, hey, what should I do about my rebellious teenage kids, you know, I would very much listen to the wisdom that she had, not because she'd been through it, but because she'd been on a developmental path. So in integral medicine, we consider all aspects of the human condition. Nothing is independent of anything else. And over time, we see that there's a cultivation of virtue in the patient's life, a recognition of her deepest and highest potential, and a move towards more wholeness and less division, even in the face of physical illness, because yes, we can't cure everything that walks through the door. Now think about Shepherd Spinal Center here in town. What a cool place, you know. The men and women that cross the doors of Shepherd Spinal Center faced with paraplegia or quadriplegia end up being some of the coolest people that you'll ever meet. Why? Because they're forced to do this inner work, because they can't run around and work 80 hours a week like we can, or they can't engage in some of the other behaviors that we can. So they're forced to do the inner work, and you know, most of them do. So when I was running the pain clinic at Emory, the inpatient pain service, there was a guy, a physician assistant in a wheelchair, and this is back when I was young and didn't know very much. And I said to him, "Pat, how come you're so cool? You know, you're in a wheelchair and you've got these struggles, and we're up walking around, and I don't know if you've heard, but it seems like if you go in the lounge and have a cup of coffee with us, we're just complaining the whole time." And he said, "Oh, Anna, that's because I was forced to do the work of inner development when I was a patient at Shepherd Spinal Center over a couple of years, or else I was going to continue suffering." Is that not inspirational? I'm sure you have patients like that. So integral medicine, my ears perk up when I hear someone talking about integrative medicine, because often it does mean we're just, you know, you're picking from a menu of therapies, and that's called integrative. But there's no unifying theory. There's no developmental tug. We've made the move in medicine from a dominator hierarchy, where the white-coated physician will tell you what to do and don't ask any questions because I'm educated, you know, beyond you. You wouldn't understand anyway. To a developmental hierarchy, where when we really are in partnership with our patients, hopefully we're asking this question. In the background of my mind is this question at all times: what habituated thinking patterns and habituated behaviors are interfering with this patient improving, realizing her highest potential, whatever that is, and what could she be doing that would make things better? And you know, I have never asked myself that question and thought to myself, "Oh, nothing, there's nothing I could be doing better." You know, there's always something. So development is an endless process. And the study of integral medicine is a lifelong, endless developmental process. May you endeavor to learn for the rest of your life. So integral medicine considers the patient's health history, their family history. You know, what are you coming to see me for? A lot of times they're coming in for some sort of pain problem. What's their diet? You know, I treated a patient about 10 years ago that out of 21 meals a week, at least 15 of them were not only at fast foods, but in the drive-thru. So she was eating in her car, you know, while she was driving. So that's pertinent. What are their life circumstances? What's their relationship to others in their life? What's their relationship to their work? Recently, on an interactive blog that I participate in, someone posted a fairly complex case report of a woman who hated her job. And I propose to you that if there's something that if we're just if we're spending our energy just getting through the day, and we're cynical about what we're doing and we're hating our job, you know, it's probably time to find another job. That's standing in the way of our development. Now, you have to be careful the way you say things or you'll run people off, right? You know, so I try to put just enough evolutionary tug on patients that they're more interested in what I have to say. And, you know, I try not to practice medicine so that I'm having patients leave and, you know, getting hate mail. What's the patient's cultural conditioning? So, you know, does the patient come from a culture where women, for example, are marginalized and have to cover themselves? And is the patient coming from a? I love to talk about, you know, that deep Southern conditioning where I said to my mother one time, I said, "Mama, you know, I learned that what other people think about us is none of our business." And she said, "You mean what I think of other people is none of my business?" No, you know, she just couldn't get it. Because she'd been raised in the South, you know, where what other people thought of you was paramount, you know. And so that matters. And so we consider, for example, generational factors. You know, the millennials that are coming up behind us, they're our hope. You know, they are our future. But have you noticed they never read the instructions on anything? They figure things out interactively. So what an inspiration. And then also, is the patient living up to what she says she believes in? So we were talking about this earlier with this diabetic patient. She says she values life and wants to live, but she's tolerating and eating and encouraging a blood sugar of 400. Now, integral medicine, therefore, is beyond any technique or style. You can practice integral psychotherapy, you can practice integral DBT, you can practice integral CBT. It considers something called all quadrants, all levels, and I'll explain that in just a minute. And it has development as its goal. Now, y'all have all seen Maslow's hierarchy of needs, but we meet the patient where they are. If they truly are, you know, I've worked on the psychiatric ward at Grady in the late 80s, and I just learned so much working from there. Sometimes it is, we have to get this patient interested enough in food so that they can eat because, you know, they're 85 pounds. So sometimes it is eating and taking care of bodily needs. A lot of what we're seeing in our clinic is higher up on the hierarchy, and we're working with issues of self-esteem and confidence, and then above that, you know, we're trying to uncover one's best potential, so we might be talking about spiritual matters, and how is the patient either able to live up to that or not? What's standing in the way of that? So there's another thing that I'm not including just because of time called spiral dynamic theory, but that we could talk for 30 minutes about how that helps us recognize where patients are. It's a very practical model that pertains to in the clinic. Now, let's look at the rise of this mechanistic view of medicine. René Descartes was a mathematician and philosopher and scientist who lived in the 1700s, who was the first to describe, remember this is the age of reason, the Enlightenment. We're beginning to see through some of the superstitious mythic structures in our culture. The printing press has been invented. Lay people are reading, and we don't need priests to interpret the Bible. Lay people are reading the Bible. I think Martin Luther's reform had happened around this time. We're beginning to realize, oh, there's no one up in the sky pulling the sun across the sky with a chariot. You know, there's actually these planetary movements. So we're beginning to understand this. Descartes described the physical body as a machine made up of parts and said, you know, hey, if one of these parts goes wrong, we can replace it. So it made room for beautiful modern medicine, things like organ transplants and antibiotics to kill those pesky bugs, you know, that are causing disease. It described the lungs as bellows, the kidneys a filter, the bladders, you know, a little holding tank there. Eastern medicine describes the body as a garden and says, you know, what happens upstream of the garden affects the garden. So if it's a particularly cloudy day, you can see in the head there's lots of clouds. You know, the swamp, which is the pelvic region, is going to be damper than normal. In Chinese medicine, dampness is a condition that we treat that's associated with certain types of pain, but also foggy thinking, heaviness in the body, confusion. So acute medical conditions, appendicitis, acute suicidal ideation, respond well to emergency care, medications, surgery, hospitalization. Chronic medical issues often don't respond. You know, the chronic back pain patient that goes to the ER for the 20th time in 2 years, you know, and the ER docs say, oh, here's Mr. So-and-so again. You know, this happens behind the scenes usually, but that they're not getting adequate care. So an integral approach is often much more useful than just this Cartesian approach in chronic conditions. Now, we know in mental health, there can be a background of mental health issues and then acute issues that arise over that. So we need both the Eastern and the Western model. We can't, it's not one or the other, it's both. And the appropriate application, knowing when to apply. Now this is Ken Wilber's work, one of my favorites. He's the premier modern day philosopher. Ken Wilber, he's out in Boulder, Colorado. Please don't worry about reading the slides. We're only going to talk about the 4 quadrants. This is called AQUAL, all quadrants, all levels, or AQUAL, and it's what any integral anything has to be looked at through this lens. So let's talk about what is this lens. In the right upper quadrant lies the objective, out there, what is it doing? So all the pharmaceutical companies are, and most of the studies that they publish are based on what is it doing. Excuse me. When we give half these patients with depression this medication and the other half placebo medication, what is it doing? What's happened to serotonin levels? What's happening to dopaminergic functions in the body? What's happening on this questionnaire? This is how we're going to assess the depression. What's happening there? So it looks out there at the object. The upper left quadrant considers something that y'all are all experiencing right now is your own subjective experience. This cannot be discounted, and it's equally as important as what's it doing, is how do you feel? I mean, isn't that the first question you ask a lot of your patients? How do you feel? The left lower quadrant asks about the intersubjective space. What's going on with this patient and her relationship to others in her life? It also considers the therapeutic relationship between the therapist and the patient. And is it an appropriate one, or do we need to switch? You know, in our clinic, an important question after 3 or 4 treatments, if someone isn't getting better, is would they do better with another therapist? We have 4 clinicians in our practice. The lower right quadrant has to do with how does culture view this patient's condition. You know, mental health and addiction and schizophrenia have historically gotten a bad rap. And, you know, in fact, we had to institutionalize them 30, 40 years ago. Substance abuse disorders are ill understood. If we legalize marijuana and diminish the prison population of all people that were in that had, you know, mandatory sentencing for simply marijuana, you know, we'd solve the prison problem. And so, you know, because the prisons are overcrowded and they're running out of money. You know, so let's look at substance. Let's look at mood and mind-altering substance from this 4-quadrant view. The right upper quadrant says what happens over time if someone drinks on a regular basis. What happens over time? Well, of course, it depends on if they're an alcoholic or not. So in the right upper quadrant, we might ask, what is alcoholism? And how do we diagnose it? And how do we treat it? So that's the right upper quadrant. The upper left quadrant asks, how does a patient feel when they drink alcohol? So, you know, alcoholics say they feel a tremendous sense of ease and comfort. That's directly from the big book of Alcoholics Anonymous. People drink for the sense of ease and comfort it provides. And the thought that you're going to ask them to go without drinking, you know, discombobulates them. So I never ask that, but I do make my clinic a place where we can talk about substance abuse. The left lower quadrant says, what happens to the patient's quality of life in relationship to his or her family when, you know, when he's 6 sheets to the wind at night, you know? So it asks about interpersonal relationships. And the right lower quadrant asks, well, what are we going to do about this patient who's now had 6 DUIs? You know, does this patient need to go to jail? Does this patient need to go to treatment? Have they already been to treatment and did it work? And if not, why? You know, so that asks these kinds of, because you can run anything through. You can run poetry through this AQUAL lens. So if we're looking at a river, for example, this is just a fun thing to do. The right upper quadrant says, well, what's the temperature of the water and how fast is it flowing? The upper left quadrant asks, well, how do you feel when you're standing on the bank of the river, watching the river go by? And then the left lower quadrant asks, hey, what kinds of, what goes on in this space between us when we're standing by the river? So, you know, I think of a romance, you know, a romantic, oh, he's asking her to marry her, you know. And then the bottom right asks, what kind of rituals does our cultural, you know, so baptism at the river was a very beautiful thing, very accepted in our culture, to go down by the river and get baptized. So this is a little bit hard to read, but the upper right quadrant said, what is it doing? The upper left quadrant says, how does the patient feel? The lower left quadrant says, what's the quality of the patient's relationships when she's engaging in this or that behavior? And the lower right quadrant says, how does culture view this? Most experts agree an integral approach is best, especially for chronic illness. And most of what we treat, I've listed here: mental illness, chronic pain, fertility disorders, functional bowel disorders, and we work with a lot of autoimmune disorders also. I like this definition of integral medicine. It means that the entire scope of treatment of any given individual occurs in a large context. So we have to ask about what's the patient's life conditions, what's their constitution. In acupuncture, we make something called a constitutional diagnosis. And a constitutional diagnosis asks, what is this patient's inherited and inherent strengths, and what are their vulnerabilities and their weaknesses? Integral medicine asks about the patient's cosmic development. You know, I mean, do they think the world is 6,000 years old, or can they see themselves as the product of 13.8 billion years of cosmic unfolding? A much bigger picture, you have to admit. And I don't ever try to change people's minds about what they believe, but we'll talk about it. Integral medicine, in short, addresses all aspects of what it means to be human. Now, mental illness, from a holistic and integral perspective, is viewed as a disease of separation. And the patients often will report that they feel that something is wrong with them. Internally, they may feel divided. I've worked with some addicts and alcoholics that say, I don't want to drink, but I can't not drink. You know, and this leads to them feeling very divided. Externally, the patient may feel separate. There was a little commercial, I think it was Zoloft a few years ago. They had a little bubble. When the little bubble was, he was feeling all sad in a group. And the commercial said, you know, do you ever feel this way? And I thought, well, yes, I feel, you know, I need an antidepressant. You know, and it was a commercial for an antidepressant. I think it was Zoloft. It was a little Zoloft bubble. And, you know, of course, we can all identify with that. So is that a pathologic condition, or is it just the human condition? And then, now, we all have life experience, of course, is a process of, none of us have had perfect lives. There's no such thing, you know, as a perfect life. And we all, to some extent, have had an incident or more than one in our lives where we're separated from original nature. You know, we forget who we are and why we're here, and we forget that from the, you know, from the biggest. Isn't it interesting that when we think that we're at the leading edge, we have this thing called human consciousness, so we have this awareness that we're aware. Isn't it interesting to think that we're at the leading edge of 13.8 billion years of cosmic unfolding? You know, it can make you feel kind of small when you go out and look at the stars, but it can also, at the same time, be awe-inspiring. Why? Because you were born. You were born. You know, so this is this upper left quadrant, subjective space. We all have an experience of, in a sense of I, or self. So integral medicine is ultimate. So in heart shock, there's this separation, and any good therapy that's integral in nature leads to a rectification of this separation from original nature. We'll talk a little bit more about that in a second. Now, please don't read this, but if you'll just listen, I want to read. Richard Tarnas is at the California Institute of Integral Studies, and he's a really neat PhD in, I think, cosmology and perhaps astrophysics. And he spoke recently and said something that I thought was so beautiful. I just had to include it in this lecture. But he said, on James Hillman's acorn therapy, just as the acorn holds implicit within itself the pattern for the growth and the maturation of the oak tree, and it draws to it what it needs in order to actualize its potential, so does the individual human being. I just think that's so beautiful. Each of us is shaped by a unique by a unique individual energy, a calling that is expressed in many different ways throughout the lifetime, and it draws to it the experiences that are necessary for what is to come, for actualizing this potential. And he briefly touches on different ways of knowing, subjective and intersubjective ways of knowing, and the problems when we focus too much on the right upper quadrant. Starting with the age of reason and through the emergence of the information age, where we are now, science has become the most powerful force shaping our worldview. It has become a new faith as we objectify nature and the cosmos. But let us see ourselves as a part of that and not apart from that. And so Western medicine, looks at it out there as though there's no observer effect. More and more studies are showing there's an observer effect. Quantum physics talks about the potential of something to be a particle or a wave, and Schrodinger's cat talks about the potential in a thing, and we don't know which one it is until we observe it. And the observer effect also asks the question, well, what does me observing it, what effect does that have on the it? So we simply can't separate this two. Now, the shameful thing is that there's been a call for a new paradigm since my time in medicine. I was just a teenager when this article was published, but it called for a new medical model. And the conclusion that the author of this paper draws, and this is on your bibliography also, is the dominant model of disease today is biomedical, and it leaves no room for the social, psychological, and behavioral dimensions of illness. A biopsychosocial model is proposed that provides a blueprint for how to run your practice and for teaching. In our clinic, we don't copy studies. So one reason you're not going to see a lot of studies on integral medicine or acupuncture is because they don't allow for individualization of treatments. They say put these 6 points in every patient that comes in with back pain. Well, those aren't the ones I would choose, knowing the patient's constitution, what's going on in their life, what was happening at the onset of the back pain. So we have developed we see about 400 patients a month in our clinic, maybe 500, and we have developed a large database of clinical results over the past 14 years that we've been doing this. Acupuncture needles are rarely in the area of complaint, so Mark's going to talk a little bit about that after me. Now, chronic medical conditions, I know this through direct experience with my own family. It's easy to go from place to place to place seeking an answer, but I've kind of freed people up with this thought that one place is going to have an answer. An integral approach does say, with a unifying theory, as long as there's development as the goal, that chronic mental illness may do well with an hour. I think I was looking up the DBT model. They do this. They do individual treatment. They do group therapy. They might have some component of, I've been very impressed with Carol's work. She has some component of physical exercise in her program. She has a spiritual component. It's an integral approach. And so, so that they don't have to keep looking for that one solution. It's probably going to be more than one thing. Now, in our super specialized Western medicine, I know y'all have had this experience where you go to one doctor for your lungs, and then you go to another doctor for your sleep and mood, and then you go to another doctor for your GYN needs, and they're not really talking to each other. And we've become this medical society of super specialization. And my friend Carter Phipps, in his book Evolutionaries, which is an excellent book if you're interested at all in reading, Carter Phipps's book Evolutionaries is wonderful. But he says, we're so super specialized, we're going to know more and more and more about a narrower and narrower and narrower field that pretty soon we know everything about nothing. and then he also said, in the area of generalization, so we need generalists in medicine and in other fields too, people that can step back and look at the bigger picture. We have to be careful because they can know more and more and more about less and less, so they can be such a generalist. We say they know they know nothing about everything. So that's an interesting thing. So it's very unusual, for example, for someone to go to their psychiatrist or to their pain management doctor and have them say, I'm looking for an acupuncturist, do you know anybody? Because even though I'm a Western physician, we tend to be marginalized. That tends to be something that there's not a lot of evidence for, but it's not true. But that's what people think. And so look for Western medicine physicians that might answer the question this way: I don't know, but let me look into it for you. You know, they have a little bit of humility about them. These are some different therapies that may be part of the integral approach. Biofeedback and neurofeedback. These are two of my favorite things. If you get a good biofeedback or neurofeedback therapist, it's key in helping solve mood disorders, helping heal chronic pain and the division that arises from that. Very good for insomnia. Medications may be used. That's your right upper quadrant approach. Herbal formulas typically they're typically a 4-quadrant affair, because we're not just looking at the chemicals, but we're looking at the relationship between the herbs in the formulas. Most Chinese herbs have 10 to 15 separate herbs in them to minimize the side effect of any one herb. So herbal formulas tend to be a 4-quadrant affair, as in contrast with Western medicine, which is a right upper quadrant affair. And then these other things you see here. I'm a big fan of group therapy and, of course, individual therapy. Support groups, 12-step support groups are wonderful. And then community or individual acupuncture, bodywork, Tai Chi, Qigong, yoga. These all may be part of your integral approach. Now, we know that the reductionistic model is incomplete, yet it's almost, I have physician friends that are in the field of psychiatry that spend their whole day doing 15-minute med checks. I'm seeing a patient that's an 84-year-old psychiatrist. He still sees patients 1 day a week. And I said, what's the biggest change you've seen in medicine? And I thought he was going to say something like, oh, the medications we have, you know, the antipsychotic medications alone are much better than they used to be in the 50s and 60s. And I thought he was going to say something like that. And he said, oh, the therapy. You know, a lot of psychiatrists don't know how to do therapy. And that's one thing he had seen as the biggest change. And so we relegate that, you know, to therapists, and then the psychiatrists are just doing 15-minute med checks. And using the integral model, patients can discover what works for them. Okay, so this is just a review of what we talked about. Integral medicine leads to less division within, what the patient reports, and less division without. Their relationships in their life, their relationship to resource, their relationship to work is becoming less divided, more whole. There's nothing that they don't want to talk about. You know, everything's on the table for examination, and the question is, what's the relationship between these things? There was a newer study showing the benefits of meditation in the chronic pain setting. Meditation is an act of sitting still and observing the mind. Now, there's two different types of meditation. One is a seated meditation where we're focusing on the breath or a mantra, or we might be listening to a tape. There's something that shakes us up a little bit more about what we call seedless or formless meditation, and that's a practice of letting go of the numerous thoughts that come in when we try to sit still. If you're anything like me, you know, 100 thoughts come in a minute. And meditation without seed is the act of letting that go. Why would we do that? Because the mind is relative compared to the deeper aspects of self. The mind is a thought-generating machine that orients us to time and space and helps us judge situations that we need to be able to judge. There's a noise. Do I need to get up and check the front door? You know, or is it just the shutter banging against the house? Meditation is the act of awakening to consciousness itself, who we are beyond all relative aspects, beyond gender and cultural conditioning. Who are we and why are we here? I wonder that a lot. Healing touch is another form of integral therapy that may be used. And by the way, all these therapies can be misused, and we'll talk about how to find a practitioner in just a second. Acupuncture, as we mentioned, is the science of relationships. It is integral in nature. There's a microcosmic view of the body that's reflected in the macrocosm and vice versa. It's effective for both acute and chronic illness. The NIH convened an expert panel in 1997 that established what is the evidence. You know, these looked at RCTs and evidence-based medicine for acupuncture. They have a list of conditions that it's helpful for. And we know that the collective anecdotal experience of over 3,000 years is very valuable. So, for example, in Chinese medicine, contrasted with Western medicine. When I say the word earth, the little, Chinese medicine is pictorial in nature, and little pictures, little poems, if you will. So the symbol for earth has a part of its picture that reminds us that the earth has a nutritive capacity. And this makes sense. Our food grows from the earth. There's another little part of the earth picture that shows that the earth has a regenerative capacity. So you all know earth mothers, that just have lots of babies and seem to have such great ease raising 6, 8, 10 kids. The earth mothers, they're just, rocking and breastfeeding and cooking and sewing all at the same time. So the earth has a regenerative capacity. Another part of the picture in Chinese medicine for earth has an altar. The earth rises up in form to meet that which is higher, heaven in Chinese speak. And lastly, the earth is an altar where we all gather. So the earth has to do with the collective. But in Western medicine, when you say the word earth, I think of the globe. Or I think of the terrain, the dirt. So I've really felt like Chinese medicine has played a large part in the awakening within my own heart as I'm interfacing out in the world, both in clinic and with other people. So I think Mark's going to talk a little bit about qi, but the only thing I wanted to say about this is this is the symbol for grain in Chinese medicine. The grain is within a pot, and off the pot is a rising steam. So energy and matter comprise qi, and qi is present in all life. And acupuncture is a medicine that moves, manipulates, and encourages the smooth flow of qi. By the way, the U.S. military has started to use acupuncture on the battlefield and outside of the battlefield. An entire medical acupuncture journal issue was devoted to acupuncture in the military. It's the December 2011 acupuncture. And I can't think of a better treatment for PTSD than community acupuncture or one-on-one acupuncture, if you can't do that, and the integral approach that acupuncture fosters. The lowest level physician treats symptoms only. So if your shoulder hurts, they'll stick a needle in for shoulder pain. The mid-level physician treats constitution, so it's not only interested in what are the symptoms, but who is this patient coming in and what's their constitution. And the highest level physician helps the patient fulfill their destiny and promotes vertical development towards that which is higher. And it promotes the evolution of consciousness. So of course this makes us ask questions of ourselves. Well, what is our destiny collectively as the human species and also individually? Why is the development of the practitioner of primary importance in the integral model? Well, because the integral model is based on a developmental hierarchy, which says that life is about endless development. So, if I'm paying to go to therapy, she better know more than I do about, and I want her to apply a little bit of an evolutionary tug. I want her to help me see where I'm not realizing my highest potential and give me, practical, proper tools on how to properly use my will around that thing. So for example, I've been eating a lot of sugar because I like it, In the developmental model, there's a great interest in what we don't already know. So it's just hard to stand up and talk about integral medicine without leaving a lot of open-ended questions. And I have a feeling y'all have that in your counseling and psychiatric and psychological practices. And sometimes just exploring that within a group is therapeutic in and of itself. So healing becomes a return to wholeness. It's free of the past. We're not victimized by the past. We're informed by it, but not victimized by it. It's beyond ego, so I no longer see myself as separate, but I see myself as a part of this one humanity here. I'm interested in making a contribution to the best of my ability, and I aim to be awakened to my highest potential. So I thank you for your attention, and I look forward to our next talk, which is on the specifics of acupuncture. Thank you.